Our surgical procedures that we perform in our certified center in the office are done under local anesthesia. Having been trained specially in anesthesia, I understand the benefits of local anesthesia versus general anesthesia, and our patients wish frequently, more than ever, to be done under the safety of local anesthesia with sedation. Starting from the top, services that we are involved in almost on a daily basis, because we do operate 4 days a week, are the brow lifts. In the brow lifts, it depends upon the degree of brow dissension as to what the procedure will be. If it is a full brow dissension, the patient wishes to have a brighter look to them, then that is usually done by a procedure called the endoscopic forehead lift, and it is a procedure that 5 of us developed in the country for plastic surgeons over 25 years ago. I have been fortunate to write 2 books on it, and I teach it at the national and the international level, but that particular procedure is done under general anesthesia. In the office, for lesser degrees of brow lifting, we do it by a procedure called the lateral brow lift, where under local anesthesia a very limited incision is made behind the hairline for elevation of the brow. Patients do quite well, there's minimal discomfort, and generally the brow will look elevated, but not absurdly elevated, but elevated with improvement of the hooding that is underneath the lateral brow. Frequently, our patients present with both brow dissension and upper lid skin, because they do go together. If the brow is descended significantly, it will contribute about 10 to 15% of extra skin to the upper lid. So it is incumbent upon us as surgeons to be able to tell patients, I think you should probably consider more of a brow lift than an upper lid blepharoplasty if the brow is the major contributor to extra skin to the upper lid. If the brows are perfectly fine, but there are extra skin to the upper lid with fat, then it is an upper lid blepharoplasty. An upper lid blepharoplasty is done in the office under local anesthesia. It's a very quick procedure, but it must be done meticulously to not only consider removing fat, and we remove fat very conservatively, but also to remove the extra skin that will allow you to close your eyes safely when you're asleep. If too much skin is removed, and if the globes are, for example, too large, then one may get into problems with the inability to close the eyelids. Along with the removal of extra skin and fat, there are patients that present with primary dissension of the upper lid, and that particular procedure is one more of skin, not of skin removal, but of adjustment of the muscles that control the position of the upper lid.